Our next speaker is Dr. Sumithra Premadasa. Dr. Sumithra is a medical practitioner running her own clinic in Kuala Lumpur, Malaysia. During her long medical practice of over 25 years, she realized that many medical symptoms stem from deep-rooted psychological factors, the treatment of which needs a holistic approach, especially in conditions where medication is of little use. Thus, she decided to venture into mind-body healing methods. At present, she is a practicing clinical hypnotherapist, lecturer for LSCCH Asia, and lectures in Kuala Lumpur and Singapore. She is also involved in research work conducted by LSCCH into hypnosis and its role in helping various conditions, including patients with cancer. Her talk is titled The Silent Epidemic, Insomnia. Thank you.
Thank you, Tom. I hope everyone can hear me. Julian?
Hi, Dr. Sumithra. Everyone can hear you clearly in the video.
Okay, thank you.
No problem.
Yeah, thank you very much, Tom. And I really thank for this opportunity to have given the, this slot to speak about something I really am very interested in, which is insomnia. And can I start the screen share now?
Yes, you can, Dr. Sumithra.
Yeah.
You've got that privilege.
All right. Just let me share. Yes. So, yeah. So living and thriving in the new normal. I'm going to speak about one of the most important aspects of our lives. That means sleeping. So there has been a silent epidemic, although we never realized it. Millions of years, people have been suffering from insomnia, and there is enough evidence in the olden days scriptures where there have been sleep temples called Asclepions in Egypt, Greece. That was about 2000 BC, where insomnia, pain, and headaches and such symptoms were treated. Interestingly, they were called sleep temples, not because they used to treat sleeplessness, but interestingly, it is because they treated all these conditions with hypnosis. Then were called sleep temples. So sleep problems are common at the best of times. And our lifestyle, our modern day, the rat race, are causing a lot of stress and conditions to be, for us to be at a very high level of stress. And one more thing is that lack of understanding of the importance of sleep. This is something we don't really put our minds into. It's just thought that this is one of those things. Yes, I'm stressed, and so I can't sleep. And the incidence of insomnia is not reported, really. Everyone goes through it. We all have gone through it. So it's taken as just another, discomfort. Unfortunately, the current pandemic has created a whole host of new stresses, turmoil, the worries, and those who have never had any insomnia problem, good sleepers, are also affected by it. So insomnia is a presence, it's defined as presence of long sleep latency, difficulty in falling asleep, frequent nocturnal awakenings, prolonged periods of wakefulness during the night, and frequent transient arousals. These are taken as some signs of insomnia. So before we go to talk about insomnia and the effects, we have to talk a little bit about sleep. And sleep is a birthright, as we know, and we need sleep. It is an active, dynamic, psychological process that throughout our lives, every day it happens. And this is because we need to reset, we need to repair, we need to regenerate, rejuvenate, and our physical, mental, and emotional health. And it's also very important for growth, especially young children, babies. Babies sleep about 16 to 18 hours a day. They don't do anything. They don't lift a finger, but they sleep 16 to 18 hours a day. That is because they are producing their growth hormone during the sleep, which is very, very important for them to grow, become bigger and mature. So people who have been in the other interesting thing is people can live without food, without water, drinks for a long time, but not sleep. 11 days of continuous is a lack of sleep, deprivation, they can cause death eventually. So let's see a little bit about the stages of sleep. What happens when we go lie down and we think, okay, this is time to sleep. And when we lie down, we know the thinking phase starts, and thoughts will come, thoughts will go, they will cross your mind, but you just let them go around. And then if you have nothing to think about, otherwise, no problems, there is a fantasy, some pleasant thoughts may come. And this leads us to go into a hypnotic state, where the body relaxes, muscle release tension, and we enter into from there, we enter into the sleep, and then we travel down to our unconscious sleep, which is the deep sleep, where delta waves start processing the whole, at stage 4. So this is a little graphic. The important part is here, the alpha state, going to hypnotic state and sleep state. This is the next important place is stage 4, and the next important state is REM sleep. So in the alpha state, what happens is that, as I described before, the hypnotic state comes in, and then you are pulled into sleep. And we're going to just look at what happens here. So the REM stage, about 25%, and non-REM stage is 75%, and 5 to 6 full sleep cycles are good for everyone to be refreshed and rested in the morning. So REM sleep, there are memories are consolidated, processed, resolved, and stored in the long-term memory, and processing information, learning, and mental concentration, and mood regulation, and work performance, and overall quality of life. REM sleep helps that. Lack of REM sleep obviously will start the difficulties, the stresses, emotional stress, distress will start, and then from there, depression, anxiety, and it becomes a vicious cycle. So over-arousal because of the stress, insomnia causes distress, further arousal, further insomnia, and it goes into a cycle. And the susceptibility to depression, we are susceptible to depression and mood disorders, and our immune system can get weakened, pain, we feel pain more deeply, and as I said, regeneration and growth of new health cells can be blocked. So now we come to delta sleep. Here, the most important thing is the production of growth hormone. This is very, very important for all over health, and other things like information processing, also energy restoration, cell regeneration, blood supply, growth repair, and immune system. And it even is said to help vaccines to work in the body. So what happens there? The body actually slows down. The blood pressure, heart rate, breathing, everything goes down, and the parasympathetic nervous system kicks in. When we are awake, we are basically functioning on the sympathetic system. Now the body has its own mechanism of bringing that balancing act by kicking off the parasympathetic nervous system, and all again repairs muscles and all the good things that happen. So lack of restorative sleep raises chances of the infections, memory problems, and a whole host of other health issues. And this picture I put just to show how much we miss important hormones when we don't sleep, the production of important hormones, the growth hormone, antidiuretic, and melatonin, oxytocin. All these things, the production is lessened if we don't have enough sleep. Those are produced in the brain and rest of the body, another list of hormones. So if we don't have enough sleep, definitely these hormones are going to be in low production. So what controls sleep? In human beings, the circadian rhythm and the sleep and wake hemostasis. So circadian rhythm are our body clocks, and sleep wake homeostasis is the internal process that we intrinsically have. Circadian rhythm depends on the external cues from outside. So disruption of any will cause insomnia. The circadian rhythm depends on the lights, the amount of light that get in. Generally, as darkness sets in, that stimulates the pineal gland and it produces melatonin, which initiates and maintains sleep. And when the light comes out in the day breaks, this process is inhibited, and other chemicals start being produced in the body. So melatonin causes the sleepiness and maintaining, and serotonin and certain other neurotransmitters and other chemicals keep us awake. And this is how it happens. Around 9 p.m., melatonin is secreted, and it will go through in the night, and in the morning around 7:30, the secretion generally stops. And we are awake, and then back again every day. This cycle goes on, supposed to go on in the night. And the important thing is, in the cave people's days, they just depended on the light of the sun and the darkness in the night. So they had no problem having this rhythm regularly all the time, every time. There was no other interactions, intrusions, nothing. But today we have the artificial light and our lifestyle, everything prohibit us from having good circadian rhythm. And the sleep-wake homeostasis, it tells us intrinsically the need for us to sleep is accumulating. As we work through the day or even anytime, it's accumulating and creates a drive that balances sleep and wakefulness. So both these together work, they function together and keep the sleep and wakefulness balanced. So what happens in people who can't sleep? Difficulty in transiting from that thinking stage to the fantasy stage, or simply stay in the thinking state way too long. And they just go on thinking and latching on to some thought and just going around thinking about something. So this happens usually because, as we know, worried about something. This has happened to all of us, and it generally delays the onset of sleep for us. And either that or they don't know how to control their own mind, or sometimes it can be habit. And they find themselves not falling asleep as usual. And the more they try to fall asleep, the worse it gets. And so this is a cycle. So life stressors keeps us aroused during the day. We are hypervigilant, hyperactive sympathetic nervous system, and then constant anxiety, worry, rumination about life stressors disrupt the sleep. Then we start having acute episodes of insomnia and difficulty initiating and maintaining sleep happens at night, and worry and rumination, then after some time, worry and rumination will shift from the life events to the worries of the being unable to sleep itself and the daytime consequences of lack of sleep. And then chronic insomnia sets in. So what starts as a simple insomnia can turn into a chronic insomnia for months and years, sometimes in people, if they are not attended to. So insomnia is a stress-related condition. When it is due to stress of COVID-19 pandemic, it's called coronasomnia. And also sometimes you may hear COVID-somnia. And when it is related to problems, when the insomnia, sleep problems related to pandemic. So there is, there is increased anxiety and more complicated than typical stress-related sleeplessness we generally have. And there is definite deep impact on sleep and our mental health. So just to talk a little bit about COVID-19 and insomnia. Insomnia may be one of the most common neurological and psychiatric outcomes from COVID-19. It's needless to say, because stress is related insomnia, stress, insomnia, and it just goes on its cycle. And what we have to go through during this period of time, the stress levels have skyrocketed. Why? Because we have never experienced this kind of calamity before. Our bodies don't know how to handle it. And the constant state of uncertainty reduces energy and it becomes a tiring thing. And the fatigue and the restlessness in the mind, even if we sleep, it will not go away. And even when you wake up after having slept well, we still are going back to the bad mood. And the rest of it is what worries are due to infection itself. We heard this all yesterday from other speakers too, but I just am going through. And insomnia is one of the main, very prevalent, and all the other possible, fear of possible the disease itself, contracting it, family, everyone, everything that is negative will start impacting the people. So then next is loneliness and isolation and all that social distancing that we never had in our lives. And worries about all this, staying healthy. And information overload is something really, really stressing for people. And also we have PTSD. It was spoken by one of the speakers, and the stress level actually escalates. And normal life routines are all disrupted in ways we have never known. And the body starts producing cortisol, and the body is aroused, the mind is turning, and we generally have bad sleep, fragmented, disturbed sleep, and insomnia. So the coronavirus is leading cause of deaths and morbidity, of course, and there is presenting a meta-analysis to make it easy that have estimated the magnitude of sleep problems during COVID-19 pandemic and its relationship with psychological distress. And this is a recent study shown in Lancet. 5 academic databases, the results were used: Scopus, PubMed Central, ProQuest, ISA Web of Knowledge, and Embase. So all came to this. It points out that the corrected pool estimated prevalence of sleep problems are 57% among COVID and 31 among healthcare professionals and 18 among the general population. And I have to mention about long COVID because we know about long COVID. The symptoms, COVID symptoms lasting for even up to 9 months after primary infections. And according to NHS, the most common symptoms are, of course, shortness of breath. We have heard cognitive memory dysfunction, the brain fog, and the fatigue and extreme tiredness. And also, University College London schools that they have identified 200 symptoms affecting 10 organ symptoms in COVID infections. So these include mainly insomnia and many other issues, hallucinations, hearing, vision, and many things. If it is 200 symptoms, they cannot be even, included here. So what is the impact of sleep problems? Impact on COVID-19 patients, healthcare professionals, and general population. The COVID patients, of course, it's a devastating thing. It burdens the body with so much of stress, varies person to person, of course, mild to life-threatening. But there's one thing, that this cytokine storm, the overreaction of the immune system that is dependent on specific genes causing it. And cytokine storm takes a real toll on the people's systems, their bodies. And these are some of the symptoms, and they all are very devastating. They devastate the systems, and along with the damage by the virus, it will become really a huge burden on the body. And all this causing a lot of stress, and people don't know generally how to manage it. So all these symptoms, extreme physical stress, mental stress, overwhelming anxiety, and confusion. And in addition, the medications that are given for these symptoms of COVID, the inflammation, steroids are used, and there are so many cases where the steroid itself is causing the patients to have severe insomnia. They actually don't know what to do. They can't go into sleep, and they can't initiate sleep, and that again causes another vicious cycle. And also quarantine, isolation, we have heard all that, and constant fear, hopelessness, helplessness. And frontliners have a different set of issues, and the uncertainty, the workplace, isolation from family, they need to be in hotels and other places, can't go home, work demand, lack of effective treatment, they're worried about the patients, little time to rest, and in addition, exhaustion, having to stand in for those who fall sick, and significant amount of physical and mental burnout, and also compassion fatigue. And they are more prone to develop anxiety and depression symptoms. And these are all, and again, insomnia is one of those. And I have spoken to some frontliners, and it really devastates them, and they can't sleep, even they have the time to sleep. And they also go into nervous breakdowns every now and then. So health professionals have a unique set of problems. The general population, we know everything, because we have been going through the lockdowns and the boxing feelings, the depression, the isolation, and they're stuck at home, and the list goes on. And the excess screen time is something that also affects sleeping, because the backlight, the blue black light of the electronic gadgets, it will keep your mind working. So, and people are working from home, no time limit. That and social media have caused a lot of anxiety for people. And these are all the stresses, and it's very difficult for people to know what to do, and what steps to take, how to do, because it's something very new. So all this add up to it's a perfect recipe for insomnia and other sleep problems. And we must not forget the children. Children are more susceptible to mental health problems, high risk of infections, grief, fear, and of course, a parental loss, separation. And those who take care of them, they may fall sick and they have to go away, and they suddenly go missing, and they don't understand what is going on. And suddenly they will be put under social charity groups, care groups, where they don't know anyone. So there is a lot of worry, separation anxiety, loss of appetite, and of course, difficulty in sleeping. So insomnia actually has been silently invading the society, although now it's so much worse. It is at all levels as never before. So the impact of chronic sleep. Insomnia commonly can be transient, few days, acute insomnia, short term, and this is like jet lag, and then a bit of grief, and chronic when it lasts months and sometimes years when it becomes unattended to. And also unable to fall asleep, waking up in the middle of the night and waking up early in the morning and unable to fall asleep. So what are the effects? Lack of sleep results in sleeplessness during day, lack of energy, confusion, forgetfulness. We all know this, we have gone through this one time or the other. And the important things are that reaction time, driving ability, handling machines, performance of any kind, cognitive skills, and psychomotor coordination, our mood, and memory, concentration, and enjoyment, family, and these all give rise to absenteeism too. So as we try to get back to the near normal way of living, stress will continue to say, and so will insomnia. The vicious cycle is likely to continue. And as therapists, we can accept to see more and more cases of anxiety, insomnia, and many other psychological, emotional issues in the coming months and maybe even years. So how can we, as therapists, how can we help? And we are equipped with tools that without medication, that's an important thing. Psychotherapies have been extremely effective in managing stress and also insomnia. So all the behavioral therapies and the hypnosis is one of the very common and very effective modality that we can use to manage insomnia. But remembering that severely affected patients may need the help of medication, and you have to refer them to the doctors and get that side sorted out. But we can always use a combination of psychotherapies and medication. There is no problem with that. And we have to spread awareness. So we got to, if you want to break this insomnia, anxiety and insomnia cycle, we need to break that. So what we can do, starting with a lot of education and starting to train them how to reset the biological clock, and get into the bed and skip the thinking stage altogether. That means consciously start getting into a fantasy stage by remembering something good, holiday we went for, something from activities you really, really enjoyed. Start thinking of that first. So the fantasy stage needs to be thoughts associated with relaxation. And one already associates that occasion with relaxation, therefore gets drawn into the hypnoidal state. So combination of the fantasy and hypnoidal state actually results in we are hypnotizing ourselves into sleep. And hypnosis, we all know, most of us know about hypnosis, and it is a trance state of our mind during which the hypnotized individual experiences a deep relaxation, focused attention, and greater suggestibility. So we need a way to gain greater access to the individual's unconscious mind, which hypnosis does, and lessening the likelihood that the subject will inject all those conscious worries, get them away, and direct them more into the process of treatment. And so because we know the ability of hypnosis to increase the responsiveness, and it's frequently used to alter behavior patterns and reactions that could be contributing to chronic health problems of all sorts. And also insomnia is one of those, and other sleep disorders. So hypnosis in insomnia, all the time as therapists, we ask the patients we listen to the patients, we let them talk, we take a history, and we try to come to the, to identify the problems that they are coming to you with. So, but I personally, any patient that comes, I always ask, after they say everything, I will ask, how is your sleep? Because stress is something always affects the sleep, but we just don't think about it. We think, yes, if you ask them, yes, of course, I was stressed, so I couldn't sleep. But they don't put so much importance into that. But it's up to us therapists to educate our clients the importance and the importance of sleep. That is why we need to sleep, why we need to sleep every night, and why we need to have good sleep. The number of hours that you need to sleep, educate them first. And then elicit issues that may be contributing to insomnia, and this, as discussed earlier, and set the goals. How many hours of restful, uninterrupted sleep, from when to when? This is very important, that they have a goal that is very particular to them, and encourage patients to explore the solutions under hypnosis. And we can use their suggestions to facilitate restful sleep, reinforce them under hypnotic trance, and deal with pain and other discomforts and maladaptive behaviors during trance. And we, of course, will have to provide coping skills like relaxation, breathing techniques, self-hypnosis, visualizations of calmness, healing. Example, the very, very beautiful healing light therapy, and use any other therapy in conjunction with hypnosis to enhance the therapeutic outcome. The hypnosis is so kind and so gentle and so accommodating. Anything you have done in the form of any kind of therapy, it accepts any kind of therapy to be incorporated into it, and which always enhances the therapeutic outcome. And a relaxation. Now, what are the methods we can use? Relaxation to counteract all that anxiety that is going on, and the anxiety that perpetuates insomnia, then the homeostasis, simulating the parasympathetic effects, and the direct suggestions under hypnosis, so that our clients can maintain restful, uninterrupted sleep, rejuvenating sleep throughout the night, and for a healthy period of decided time by the patient. And the suggestions you can give are like, each and every day you will feel more relaxed as bedtime approaches, and you will feel more and more pleasantly tired, and you will feel drowsier and drowsier. And as you lay your head on the pillow, you will experience a deep relaxation. And also that, the harder you try to stay awake, the drowsier you become. Because many people, when they can't sleep, they try to sleep. I have to go to sleep. I must fall asleep. That actually makes it even more difficult to fall asleep. So we use this suggestion so that the harder you sleep, harder you try, you stay awake, the drowsier and become, and you couple the intention of sleep to a drowsiness that will set in. And his suggestions to follow also, if they wake up in the middle of the night, you can always put in a suggestion that they will immediately close their eyes, relax, and they will fall asleep within a few minutes. And ego strengthening, we all know about it, and it is very important. And the favorite place of relaxation, I find this a really, really powerful and wonderful way to take our anxiety patients into a calmer environment. And so we can ask them to do that in self-hypnosis, which they will be doing to maintain relaxation, control, and also hyperarousal states. Self-hypnosis empowers our patient, and it gives a lasting therapy outcome. Guided imagery, very powerful. The tried and true method of self-hypnosis. We can ask them to imagine all the good things that you have taught them during your sessions, to repeat them while they're doing their self-hypnosis. And as I said, other methods, cognitive behavioral hypnosis, to break unhealthy habits, install healthy sleeping habits, or any other therapy you have learned, always incorporate them into your therapy plan. The last but not the least, sleep hygiene is very important. This is you have to educate your clients. They either might not know, they don't pay, or they don't place much importance to it. Use the bed only for sleep and intimacy. Have an adhere to a regular bedtime and a working schedule. Go to bed at the same time every night. Maintain a comfortable sleep environment, including the comfortable lighting and temperature of the room. Avoid watching television or using electronics with backlit screens, and don't keep anything, including maybe just a phone, but nothing else, nothing electronic in the bedroom. And if they lie awake, that is absolutely counterproductive if they try to tell themselves, no, I need to fall asleep, I need to fall. Just get up, go to another room, do something, read a book, and so listen to some music. And then when they are calm enough, they start feeling sleepy, they come back and go to sleep. Avoid daytime naps. Avoid meals, alcohol, caffeine, drinks, exercises too close to bedtime. And of course, you have to advise our clients to. We have to advise our clients to get regular exercise, but not at least about 2 hours before sleep. And so we have now all these things depends, all the therapy regime depends on the severity of insomnia. And we have to take into account what is the situation. If it's mild to moderate, you can do all this. And if they're severe, as I said, they're really, really bad, maybe a consultation with a doctor and some medications to start with. And with therapy, maybe we can ask them to win the medications off, but always with the consultation of the doctor. And so in our talk here, I have placed more importance on the COVID situation, because that's the topic of the day. And important thing is that where you can educate them, where you can get them to play, use the techniques and the methods of having a good night's sleep. This is very important. We know what it can do if you don't have it. So educating our clients, our patients about the importance of sleep, all of us as therapists, we need to do that, because honestly, even we all don't really place much importance to it. And you know about the owls and the larks, and some people have a different circadian rhythm, body clocks. So some late sleepers and some early sleepers, early risers. I'm an owl, I'm a very bad owl, but we need to educate our clients the importance of getting enough sleep. And the concept of beauty sleep, it is real. If you have sleep, see the growth hormones is secreted while you're sleeping during your deep sleep stage. So it will keep your body supple and energetic and active. But unfortunately, with age, the growth hormones the production tends to decline, and that is why we have we sleep very light. We start sleeping light when as age passes, and also the production of growth hormone becomes lesser and lesser, and rejuvenation and things become less and less. But still, it is important for us to, have a good sleep. Yes, thank you.
Thank you, Dr. Sumithra. Nice to see you again. Actually, we do have, I think it's a very important topic, and we have lots of questions. Some of them were addressed But in view of time, we will need to email you these questions. Some of the questions were actually addressed towards the end of your talk, things like sleep hygiene.
Yes.
But yeah, we've got quite a number of questions. So
Alright.
we'll be sending you an email, and
Yes.
we will be contacting the participants, because I think it will take some time to answer the questions as well.
All right.
Yeah. Thank you so much, Dr.
Okay.
Sumithra.
Thank you very much. Thank you,
Thank you.
everyone.